Okay, so in this slide we are going to discuss a very important topic about osteomyelitis, right? Very important topic from your exam point of view. So the question asked your feature of pyogenic osteomyelitis. Which one among these are your features of pyogenic osteomyelitis, right? Like most common causes of organism is Staph aureus, most commonly affects diaphysis of long bone, involucrum is piece of dead bone, cloaca holes, and sequestrum is dense sclerotic bone overlying lesion site. Okay, so we have to first see your this we have to discuss about osteomyelitis first, and then we will come back to the questions. Very important topic. Do pay attention. All right. So talking about osteomyelitis. So let me take a fresh slide. Osteomyelitis. Right. This is a topic. Now, if I break this term, osteo means bone, right? Myelitis means myel. Okay. Osteo means bone. Myelo means marrow. Itis means infection. So, actually, this condition is the infection of bone and marrow. So, infection of bone, marrow is your osteomyelitis, correct? So, if we break the term, it is your infection of bone and marrow. That is what is your osteomyelitis is. Now, talking more about your organism, which is the most common organism, right? So, most common organism of your osteomyelitis is your Staph aureus. Staphylococcus aureus is your most common organism. Now, this is not what they ask in nowadays. They ask that in IV drug abusers, what is the organism that causes osteomyelitis? Well, in this case, it is Pseudomonas. Pseudomonas is the most common organism in IV drug abusers. Otherwise, most common is your Staph aureus. If I talk about sickle cell anemia, which is the most common organism that causes osteomyelitis, in this case, answer again changes. It is your Salmonella. So remember all these points, right? Okay. Now next is your route. What is the route of infection? There are many routes of infection, but if I talk about the most common route, it is your blood, hematogenous route, correct? Okay. Now talking more about this, it is divided into broadly into three types. One is your acute, another is your subacute, and there is your chronic. All three are important. Let's see important points about acute osteomyelitis. Acute osteomyelitis is symptomatic, okay, and there occurs subperiosteal abscess. We will see all this in your pathophysiology section, which I will discuss in few minutes. So these things we find in acute osteomyelitis. There is radiological changes are not evident in acute osteomyelitis phase. This is usually symptomatic, and max to max subperiosteal abscess we are going to find. Subacute is your Brodie's abscess, where symptoms are on and off. Symptoms will come and go. Symptoms on and off. If I talk about chronic osteomyelitis, that is where maximum questions are asked, because there you can find radiological signs. There you can find three important things. One is your sequestrum, one is your involucrum, and one is your cloaca. These three important things you will find in radiology, and this I will show you in one of the x-rays. Okay, so what is the mechanism actually? See, if I talk about children, so this is your children, this is your adult. Okay. I am drawing the bone. Okay, so I just drew a part of the bone. Okay, so what I drew just now, this is your cortical bone. Okay, this is your periosteum, again in adult same, and this one is your nutrient artery. So the nutrient artery goes via, as you can see, if I say this is your epiphysis, of course this will be your metaphysis. So nutrient artery supplies this metaphysis region. All right, so and this is your cortical bone, this is your periosteum. So in children, see, as I just mentioned, there are many routes of infection. Like since the most common organism in our skin is Staph aureus, so even by skin scratches or even by hematogenous route or any local trauma, the organism from the skin can go via the hematogenous route and can cause infection to the bones and all. Okay, so there are many routes, out of which most common is your hematogenous route. So infectious organism actually goes via the hematogenous route. So say it is going via the nutrient artery to the metaphysis, because nutrient artery actually supplies mostly your metaphysis region, right? This is just an illustration diagram for you to understand, but to remember, the artery usually supplies the metaphysis of the bone. I have to make erase this one. Okay, just for understanding purpose I do this, but actually metaphysis region is usually supplied most by the arteries. So nutrient artery is, see, it is going like this and it is folding here, right? This is how it supplies. So if the infectious organism goes by a hematogenous route, it will go this way, and here the blood, because the artery is looping here, the blood flow will be little slowed down, and here the organisms will be static, right? They will stay here, they will cause the infection, right? And in children, as you can see, there is a gap between the periosteum and the cortical bone, whereas there is no gap in adults, but in children there is a gap. So there will be formation of this subperiosteal abscess, because the organism is static in this region. They will grow here, they will multiply here, and this will result in the abscess formation in later stages. And since there is a gap between periosteum and your cortical bone in children, okay, and that's why we say that osteomalities most common site is your metaphysis only, okay, because the arterial supply is maximum in your in this region. Also the infectious organism, they usually grows and they usually becomes stasis in this portion only, okay. So after that, after a prolonged period, there will be discharge occurring. If that goes into a chronic phase, there will be discharge. So actually this is your pathophysiology, or just a brief illustration about how things are happening. And since okay, let me take a X-ray, then I can show you better. Okay, see this X-ray. So this is all about your chronic osteomyelitis, okay. See this one. So here you are seeing three terms. One is your sequestrum, one is seeing involucrum, one is seeing cloaca. So actually in chronic stage, what happens? The inside part of the bone becomes dead. The inside part of the bone becomes dead, right? And the dead bone is now surrounded by granulation tissue. This is all about your sequestrum. The dead piece of bone is your sequestrum, and now obviously there is a defense mechanism of our body that will be active now, and it will surround the dead piece of the bone, right? So there will be a reaction bone formation, we can say, around this dead tissue. So around this dead tissue there will be a reactive bone formation. Now that reactive bone formation is your involucrum, right? And if there is discharge occurring from the bone, remember I'm not talking about skin, because often you will confuse between cloaca and sinus. Remember, sinus is the discharge from the skin. I'm talking about cloaca. Cloaca is the discharge from the bone. Now this pass has to come out, no? So if the discharge occurs from the bone, by a hole, this is your cloaca. So these all are the changes of your chronic osteomyelitis stage. Okay, so now I hope you have got some idea about the osteomyelitis, right? I will brief it again. I think this slide is clear that your sequestrum is a dead, here I will write, okay, your sequestrum is a dead piece of bone. Dead piece of bone is your sequestrum. Now it is surrounded by it is the dead piece of bone surrounded by granulation tissue. And often you will see that this dead piece of bone, this is homogeneous to your normal bone. There is sometimes its density is equal to your normal bone. It is because the calcified portion or the mineralization that was present before demineralization, because now it is a dead piece of bone, that is there is demineralization occurring, but before that there was mineralization. Now that mineralization could not recirculate, right? They could not be taken out, for which the bone density remains same as the normal bone, but actually they are dead bone pieces. Okay, so actually sequestrum is a dead piece of bone with granulation tissue, and now it will be surrounded by involucrum, which is your new reactive bone. And if the discharges are coming out with a opening, that will be termed as your cloaca. I hope it is clear. Now let's move to the question. Okay, so this was your question, the features of pathogenic osteomyelitis. So here the first they asked is most common causes of organism Staph aureus. Of course, this is Staph aureus. We just saw that it is Staph aureus only. Okay, and then they asked most commonly affects diaphysis. Actually, it is not diaphysis. Actually, it is metaphysis because of the supply by nutrient arteries and all. Okay, it's not diaphysis. Is not the most common site. It's actually the metaphysis. Okay, so this is not correct. Correct. And then they ask the involucrum is a piece of dead bone. No, so involucrum is not a piece of dead bone. So piece of dead bone we just saw, it is sequestrum. Sequestrum is a piece of dead bone and it is surrounded by granulation tissue. So this is also a wrong option. Cloaca are the holes in involucrum. Cloaca are the holes from where the discharge occurs by the bone. So this is the correct option, right? We just saw that from the bone, if there is a hole and the discharges are coming out, this is termed as your cloaca, which is in your chronic osteomyelitis. This is correct option. Cloaca are actually the holes in the involucrum. Correct. And then sequestrum is the dense sclerotic bone overlying the lesion site. Actually, no, this is not sequestrum. The dense sclerotic bone overlying the lesion site, of the reactive bone that is forming, is actually your involucrum. Involucrum. Okay, so we will revise the topic again. It's a very important topic and you should pay attention. So first we saw the osteomyelitis. Osteo is bone, myelitis, this one. Osteo is bone, right? And myelitis, so it is the infection of the bone and marrow, right? Osteo, bone, myelo, marrow. Litis means infection, so it is the infection of bone and marrow. Now organism is most commonly involved is your Staph aureus. If we talk about IV drug abusers, it is your Pseudomonas. If we talk about sickle cell anemia patients, it is the Salmonella. So these organisms you must remember. And the route is the hematogenous is the most common route, and we can divide into 3 stages: acute stage where there is symptoms and superior abscess formation. How it is formed, I just saw we just saw in the pathophysiology section. In subacute, this is also known as the Brodie's abscess, and there is symptoms going on and off. In chronic, there are radiological signs where there is sequestrum. Sequestrum is a dead piece of bone we saw in the radiology, surrounded by granulation tissue. Involucrum is a reactive bone formation. Reactive bone formation. Okay, overlaying the sequestrum. Okay, because it is the mechanism from our body, the security system of our body, right? It is what our body is doing in response to this sequestrum. Sequestrum is a dead piece of bone with granulation tissue, and involucrum is the reactive bone formation overlaying the dead tissue. Talking about cloaca, it is the hole in the bone, actually hole in the involucrum from where the pus comes out or the discharge comes out. So cloaca is the hole in the bone, we can say. Okay, so I hope this radiological signs are clear. Talking about the pathophysiology, we saw that how the nutrient artery is supplying the metaphysis in a loop pattern, correct? And now if the infection is occurring by a hematogenous route, the organism will enter via the nutrient artery, but because of the loop pattern it will become stasis here. It will multiply here, cause infection, and in case of immunocompromised person, okay, what it can do, because in children there is a gap between periosteum and cortical bone, so it will multiply, it will cause infection, finally it will cause an abscess, which is the subperiosteal abscess, because of this gap. In adults, okay, we can find in chronic osteomyelitis cases, we can find, because there is no gap, we can find this all these things that we saw in the radiology: sequestrum, involucrum, and cloaca formation. So this topic is clear for you, right?